Good evening. This is All India Radio. I'm Manoj Singh Rana and with me is R.S. Raghu with the evening news. The headlines: Prime Minister Narendra Modi reviews growing need of human resources required to deal with COVID-19 crisis. NEET postgraduate exam postponed for 4 months to ensure availability of qualified doctors for COVID duties. Medical interns to be deployed in COVID management duties under supervision of the faculty. Medical personnel completing 100 days of COVID duties to be given priority in regular government recruitments. Government says positive approach visible in COVID-19 recoveries, says some states and duties show early signs of plateauing in daily cases. 1,500 pressure swing adsorption oxygen generation plants being developed to increase availability of oxygen in the country. Over 15 crore 72 lakh COVID-19 vaccine doses administered to eligible beneficiaries till now. Mamata Banerjee stakes claim to form government in West Bengal. Bangladesh extends lockdown till 16th of May to check the rising number of COVID-19 cases. And in IPL cricket, match between Kolkata Knight Riders and Royal Challengers Bangalore rescheduled after 2 KKR players test positive for COVID-19. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for the person of age between 18 and 44 has begun at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. Now, the news in detail. Prime Minister Narendra Modi today reviewed the growing need of human resources required for dealing with the crisis of COVID-19 situation in the country. Many important decisions have been taken during the review meeting, which will significantly boost availability of medical personnel required for treatment of COVID-19 patients. Amongst many decisions, a decision has been taken to postpone the NEET postgraduate exam for at least 4 months. This will ensure the availability of qualified doctors for COVID duties. The exam will not be held before 31st of August this year, and students will be given time at least of 1 month after the announcement of the exam. More details in this report.
During the meeting, it was decided to allow deployment of medical interns in the COVID management duties under the supervision of their faculty. The services of the final year MBBS students can be utilized for providing services like teleconsultation and monitoring of mild cases of COVID-19. The services of the final year postgraduate students as resident doctors may continue to be utilized. It has further been decided that services of BSc and general nursing and midwifery nurses may be utilized in COVID nursing duties under the supervision of senior doctors and nurses. In a major decision, it has been decided that the individuals providing services in COVID management will be given priority in forthcoming regular government recruitments after they complete a minimum of 100 days of COVID duties. The medical students and professionals sought to be engaged in COVID-related work will be suitably vaccinated. Engaged health professionals will be covered under the insurance scheme of government. All such professionals will be given the Prime Minister's Distinguished COVID National Service Samman after completion of their 100 days of COVID duties. The states and union territories have been requested to consider the above incentives to maximize the availability of manpower to provide relief to the COVID patients. Swati Rakheja, News Desk.
Over 1 crore 62 lakh 93,000 people have recovered in the country from COVID-19, and the recovery rate stands at 81.77%. Briefing the media in New Delhi today, Joint Secretary in the Health Ministry, Love Agrawal said a positive approach is visible in the recoveries.
देश में अभी तक 81.77% केसेस क्योर होकर घर जा चुके हैं। 17.13% यानी कि करीब 34 लाख केसेस अभी एक्टिव केसेस की दृष्टि से हम उनको मॉनिटर कर रहे हैं, और ओवरऑल क्यूमुलेटिव फैटेलिटी अगर देश का देखें तो पाते हैं कि अराउंड 1.1% और 2 लाख के करीब डेथ देश में रिपोर्ट हुई हैं।
He said yesterday the recovery rate was at 78% and today it has climbed up to almost 82%. He added these are early gains on which we have to work on regularly.
क्यूमुलेटिव डेथ रेट देश का 1.1% है, बट अगर हम पिछले 2-3 महीने डेटा को एनालाइज करें तो कलेक्टिव एफर्ट्स बाय द स्टेट इन टर्म्स ऑफ केस मैनेजमेंट हमारा डेथ रेट अभी भी 1% से काफी नीचे है। साथ ही अगर हम डेली केसेस और डेथ की ट्रेजेक्ट्री को एनालाइज करें तो कुछ पॉजिटिव डायरेक्शन की तरफ बढ़ने की सोच सकते हैं। उस दिशा की तरफ हमने शायद बढ़ना शुरू किया है। अगर 1 मई को देश में करीब 4 लाख केसेस रिपोर्ट हुए थे तो 2 मई को करीब 3,92,000 केसेस, और अगर पिछले 24 घंटे का डेटा एनालाइज करें तो पाते हैं 3,67,000 केसेस। तो शायद केसेस में कुछ हद तक कमी पाई जा रही है, लेकिन ये बहुत ही अर्ली सिग्नल्स हैं।
The Joint Secretary said increasing share of recoveries is a positive trend, but the challenge in terms of increased active cases continues. He added some states are showing increasing trends in COVID cases and these states should take required precautionary measures. Joint Secretary Agrawal said Andhra Pradesh, Assam, Bihar, Chandigarh, Haryana, Karnataka, Kerala, Himachal Pradesh, Manipur and Meghalaya are among those states and UTs. He said some states and UTs, including Delhi and Madhya Pradesh, are showing early signs of plateauing or decrease in daily new cases.
कुछ कॉजेज ऑफ कंसर्न है जिसके बारे में हम बताना चाहेंगे। अगर देखें कि कौन सी ऐसी स्टेट्स हैं जहां पर एक्टिव केसेस ज्यादा है, जहां पर हमें एक्स्ट्रा एफर्ट करने की जरूरत है, तो ऐसी 12 स्टेट्स हैं देश में जहां पर 1 लाख से अधिक एक्टिव केसेस हैं। 50,000 से लेके 1 लाख तक एक्टिव केसेस देखें तो 7 स्टेट्स में हैं, और 17 स्टेट ऐसी हैं जहां पर कि 50,000 से भी कम एक्टिव केसेस हैं। यहाँ यह जरूरी है कि जहां पर केसेस ज्यादा हैं वहां पर हमारा इंटेंसिव एफर्ट बना रहे, और जहां केसेस कम है वहां पर भी हम किसी तरह की कोताही ना करें, नहीं तो ये सिचुएशन हो सकती है कि फिर वहां पर भी केसेस फैलने लगे, जैसा कि हमने इस सेकेंड वेव में देखा है।
On vaccination, the Joint Secretary informed over 15 crore 72 lakh vaccine doses have been administered to eligible beneficiaries till now. He said over 1 crore 57 lakh healthcare workers, over 2 crore 6 lakh frontline workers have been vaccinated till now. Over 12 crore people aged 45 years and above and 2 lakh people aged 18 to 44 have got vaccine doses. He added that 12 states have started vaccinating those in the age group of 18 to 44 years from the 1st of this month. Joint Secretary Agrawal said 1,500 pressure swing adsorption PSA oxygen generation plants are being developed. He said to increase availability of medical oxygen, the government is working on converting nitrogen plants into oxygen plants.
टोटल मिलाकर अब देश में 1,500 के करीब पीएसए ऑक्सीजन जनरेशन प्लांट्स बनाए जा रहे हैं, जिस पर काफी स्पीड से कार्य करने की एक प्रणाली भी बनाई गई है ताकि जल्दी से जल्दी इन प्लांट्स को ऑपरेशनल किया जा सके। साथ ही ऑक्सीजन की अवेलेबिलिटी को बढ़ाने के लिए एक स्तर पर नाइट्रोजन प्लांट जो हैं उनको भी ऑक्सीजन प्लांट्स के रूप में कन्वर्ट करने का कार्य चल रहा है। ऐसी 14 इंडस्ट्रीज आइडेंटिफाई की गई हैं जहां पर कि पीएसए नाइट्रोजन प्लांट्स हैं, और यह पाया गया है कि उन प्लांट्स में कार्बन मॉलिक्यूलर सीव उस इक्विपमेंट को रिप्लेस कर जियोलाइट मॉलिक्यूलर सीव अगर बना दें और रिलेटेड एसोसिएटेड कुछ चेंजेस किए जाएं तो यह प्लांट ऑक्सीजन भी प्रोड्यूस कर सकते हैं। इसके अंतर्गत ही इन 14 ऐसी इंडस्ट्रीज में 37 नाइट्रोजन प्लांट्स ऑलरेडी आइडेंटिफाई भी किए जा चुके हैं।
Additional Secretary in the Home Ministry Piyush Goyal said there is enough oxygen available in the country. He said every hospital must ensure judicious use of oxygen according to the guidelines issued by the Health Ministry. He requested citizens that along with the government, they should also ensure that no hoarding or black marketing of oxygen is done.
ऑक्सीजन का उत्पादन काफी अधिक बढ़ा है पिछले कुछ महीनों में। 1 अगस्त 2020 को ऑक्सीजन का उत्पादन 5,700 मेट्रिक टन था, जो अब लगभग 9,000 मेट्रिक टन हो गया है, जो डेली प्रोडक्शन कैपेसिटी का 125% है। इसी प्रकार से मेडिकल ऑक्सीजन की जो सेल्स है उसमें भी बढ़ोतरी हो रही है निरंतर, तथा अब ये 7,500 से लेकर 8,000 मेट्रिक टन तक प्रतिदिन हो रही है। मैं सभी देशवासियों को आश्वस्त करना चाहूंगा कि ऑक्सीजन की मांग में वृद्धि होने के बाद भी देश में पर्याप्त मात्रा में ऑक्सीजन उपलब्ध है।
Director of AIIMS Dr. Randeep Guleria said falling oxygen saturation and excessive fatigue are warning signs which indicate that the COVID patient in home isolation needs hospitalization. He said CT scan and biomarkers are being misused and there is no advantage in doing the CT scan if a person has mild symptoms. Dr. Guleria said one CT scan is equivalent to 300 chest x-rays and it is very harmful.
The fourth consignment of medical supplies containing 60 ventilators arrived from UK to India today. MEA spokesperson Arinda Bakshi thanked strategic partner and friend United Kingdom for the support. A shipment of an oxygen production plant and 20 ventilators also arrived from Italy to India. The spokesperson said India values the support from the important European Union partner Italy and it will help augment the oxygen capacities. As per the revised guidelines of the Health Ministry, the patients who are clinically assigned to be mild or asymptomatic are recommended for home isolation. For home isolation, the patient should be clinically assigned as mild or asymptomatic case by the treating medical officer, and such cases should have the requisite facility at their residence for self-isolation and for quarantining the family contacts. It says a caregiver should be available to provide care, and a communication link between the caregiver and the hospital is a prerequisite for the entire duration of home isolation. Such person should stay at home, isolate and take rest and sanitize hands. There should be cross-ventilation in rooms and all family members should wear masks. The person should monitor body temperature and oxygen saturation 4-hourly. Such persons have been advised to seek medical consultation if they feel breathlessness and oxygen saturation drops to 93% or below. Ministry of Ayush has taken steps to increase availability of polyherbal drug Ayush 64 across the country. The ministry in a statement said that Ayush 64 has been found very useful in treating mild to moderate cases of COVID-19 in clinical trials. It said the trials led by reputed scientists of the country showed Ayush 64 has notable antiviral, immune modulator and antipyretic properties. It is found to be useful in the treatment of asymptomatic mild and moderate COVID-19 infection. Consequently, the drug is now repurposed for COVID-19.
Prime Minister Narendra Modi reviewed COVID-related initiatives by the Indian Navy today in a meeting with Chief of Naval Staff Admiral Karambir Singh. The Navy Chief apprised the Prime Minister that naval hospitals have been opened for use of civilians in various cities. He said Navy medical personnel have also been redeployed at various locations in the country to manage COVID duties. The Navy is also transporting oxygen containers as well as other supplies from abroad to India. Admiral Singh briefed the Prime Minister about various initiatives being taken by the Indian Navy to assist the countrymen in the pandemic. In a major relief, the centre has waived off the IGST on the import of COVID-related medical supplies including remdesivir injection, API, medical oxygen, oxygen concentrators, cryogenic tanks and COVID vaccines among others. The exemption has been granted till 30th of June for free distribution of these medical supplies. Earlier, the centre had waived off the import duty and health cess on such medical supplies. This exemption will enable the import of the COVID relief supply imported free of cost for free distribution without payment of the IGST. State governments have been asked to appoint a nodal authority to facilitate the importers to avail the relief exemption.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi reviews growing need of human resources required to deal with COVID-19 crisis. NEET postgraduate exam postponed for 4 months to ensure availability of qualified doctors for COVID duties. Medical interns to be deployed in COVID management duties under supervision of the faculty. Medical personnel completing 100 days of COVID duties to be given priority in regular government recruitments. Government says positive approach visible in COVID-19 recoveries. Says some states and UTs show early signs of plateauing in daily cases. 1,500 pressure swing adsorption oxygen generation plants being developed to increase availability of oxygen in the country. Over 15 crore 72 lakh COVID-19 vaccine doses administered to eligible beneficiaries till now. Mamata Banerjee stakes claim to form government in West Bengal. Bangladesh extends lockdown till 16th May to check the rising number of COVID-19 cases. And in IPL cricket, match between Kolkata Knight Riders and Royal Challengers Bangalore rescheduled after 2 KKR players test positive for COVID-19. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे।
Welcome back to the evening news. In a daily media briefing of the Health Ministry today, Joint Secretary in the Ministry, Love Agrawal, said there are early signs of plateauing witnessed in Maharashtra. He said from the peak of 65,000 cases, which were reported earlier, now 62,000 cases are reported. More from our Mumbai correspondent.
The ongoing strict restrictions imposed in Maharashtra to contain the transmission of COVID-19 has been yielding positive results. According to the Union Health Ministry, there are 12 districts in Maharashtra where cases of corona have been declining. These districts are Aurangabad, Dhule, Bhandara, Gondia, Jalgaon, Latur, Mumbai, Nanded, Nandurbar, Thane and Washim. Joint Secretary in the Union Health Ministry, Love Agrawal, said that this dip in cases have been witnessed in last 15 days. The ongoing strict restrictions in Maharashtra will remain in force till 15th of this month. Kunal Shinde, AIR News, Mumbai.
More recoveries were recorded today in the state as compared to the new cases of COVID-19. About 59,500 patients were discharged across the state during the day, which took the tally of recovered patients above the 40,41,000 mark. In Maharashtra, the Nagpur Municipal Corporation has converted 25 city buses into ambulance for the use of COVID patients. Mayor of Nagpur City, Daya Shankar Tiwari, flagged off these ambulances today. He said that the number of ambulances in government and private hospitals in Nagpur are not sufficient to meet the requirements of patients amid the daily surge in COVID cases. With the induction of newly converted ambulances with oxygen facilities, the municipal corporation is hoping to lower the stress on the city's health machinery. The needy person can avail this facility by calling on 0712 255 1417.
In view of the recent spike in COVID-19 cases in Sikkim, the state government today announced additional restrictions to contain the spread of infection. The announcement followed an emergency meeting held by Chief Minister P.S. Tamang. More from our Gangtok correspondent.
The new restrictions to be effective during 6th to 16th May were announced after Sikkim recorded 1,404 COVID-19 cases over the last 7 days. The state government has decided to impose curfew during 5 p.m. to 9 a.m. across Sikkim while restricting all interstate and interdistrict movement. People's movement has been restricted in the state, exempting medical emergencies. Vehicles engaged in medical emergency, essential commodities, funeral and construction activities will be allowed ply. All people entering through borders will need to furnish negative RT-PCR report within 72 hours of entry. All commercial establishments will operate from 10 a.m. to 4 p.m. while essential services have been exempted. Unloading of construction materials will be allowed from 5 a.m. to 8 a.m. Moreover, the existing weekend shutdown for all shops in market areas except those selling essential goods will continue. With Saikat Sarkar, Parijat Sharma from Gangtok for AIR.
Government has said that a vial for remdesivir injection by the name Covipre, which is in circulation, is fake. Press Information Bureau in a tweet said no remdesivir by the name Covipre exists. People have been advised not to buy medical supplies from unverified sources and to be beware of counterfeit medicines and injections.
The Health and Family Welfare Ministry has refuted the media reports wherein it was alleged that the centre has not placed any fresh order for procurement of COVID vaccines. The ministry has termed these media reports completely incorrect, saying these are not based on facts. Giving the details of vaccine procurement, the ministry has said that an advance payment of 1,732 crore rupees was released to the Serum Institute of India last week for procurement of 11 crore doses of Covishield vaccine for 3 months. It said against the last order of 10 crore doses of Covishield vaccine, over 8 crore 74 lakh doses have been delivered so far. The COVID-19 pandemic has created an unprecedented crisis in the country. Although the government is leaving no stone unturned to check the infection and provide medical and other assistance to the people, there are NGOs and groups of people who are putting tremendous efforts to ease the hardship being faced by the people. They're providing medical assistance and food and pulling up resources and ensuring they're delivered to those who need them the most. A Gurgaon-based NGO, Hemkund Foundation, has been working to provide oxygen cylinders to critical COVID patients. Through the contribution of people, the NGO is also providing meals to the people suffering from the COVID-19 crisis. An NGO, Give India, which works in New Delhi and Mumbai, is providing relief to the people by ensuring free oxygen cylinders.
Renowned AIR newsreader of yesteryear Sunil Javeri passed away today in Ahmedabad due to COVID-19. Mr. Javeri was 90 years old and was battling the COVID-19 infection for the past few days. He served in News Services Division of All India Radio for nearly 4 decades. The government of Bangladesh has announced an extension of the ongoing countrywide lockdown till May the 16th, while allowing for the buses to resume operations within the district from May the 6th. However, inter-district movement of buses will remain suspended. Trains and waterway services will also continue to remain suspended in the country. The decision was taken on Monday during the weekly cabinet meeting chaired by Prime Minister Sheikh Hasina. Cabinet Secretary Khankar Anwarul Islam said after the cabinet meeting that local administration will strictly enforce the health regulations imposed on malls and shops. Bangladesh imposed a nationwide lockdown on April 5th as COVID-19 infection and deaths started rising alarmingly.
Trinamool Congress leader Mamata Banerjee will be sworn in as the state's chief minister for the 3rd time on Wednesday. Mamata Banerjee met West Bengal Governor Jagdeep Dhankar at the Raj Bhavan and staked claim to form the government after her party's win in the assembly elections. She'll be sworn in at an informal ceremony at the Raj Bhavan in Kolkata in view of the current situation due to the pandemic. The party's newly elected legislators will take oath on Thursday. A meeting was held at the Trinamool Congress Bhavan with the newly elected MLAs of the party. The Trinamool Congress General Secretary Partho Chatterjee said the meeting unanimously elected Mamata Banerjee as the leader of the TMC Legislative Council. Bimon Banerjee has been nominated as the Speaker of the 17th Legislative Assembly. The Union Home Ministry has asked the West Bengal government for a report on the post-election violence targeting opposition political workers in the state. Since the completion of poll counting in the state yesterday, several incidents of violence have been reported.
The results of keenly fought general elections to the Legislative Assembly of West Bengal indicate that though there were largely multi-cornered contests on cards with total 2,116 candidates in the fray for 292 seats that went to polls in 8 phases, the electoral battle actually turned into direct contest between the ruling All India Trinamool Congress and the main challenger Bharatiya Janata Party. Chief Minister Mamata Banerjee-led AITC raced to the pole position yesterday within hours of the start of counting of votes and went on to capture 213 seats while retaining the power once again. The main rival BJP won 77 seats, leaving the remaining 2 seats for others. Despite her party's spectacular performance, it remained unclear for most of the day whether the TMC chief Banerjee would make it through in Nandigram Assembly constituency. She was leading over confidant turned adversary and BJP candidate Suvendu Adhikari in the afternoon with a slim margin of 3,000 votes after trailing for several hours. Ultimately, the BJP candidate won the seat by a margin of 1,956 votes. But Nandigram wasn't the only seat that could have flipped. A quick analysis of the Election Commission's data shows that there were nearly 19 seats where the victory margin was less than 3,000 votes. The BJP had a slender victory margin in 12 of them, including 9 seats where it had a victory margin of less than 2,000 votes. In 4 seats, it had a victory margin of less than 1,000 votes. On the other hand, the AITC won 7 seats with a margin of less than 3,000 votes, including 3 where the margin was less than 1,000 votes. The Election Commission has deferred the polling in Pipli Assembly constituency of Odisha and Jangipur and Samserganj Assembly constituencies of West Bengal due to spiking cases of COVID-19. Polling in these constituencies was scheduled to be held on 16th of this month. Earlier, voting in these constituencies was scheduled along with the assembly polls in 4 states and 1 UT, but due to the death of contesting candidates of recognized political parties, the polling was deferred to 16th of May. The Commission, after taking all material facts and inputs of CEO West Bengal and CEO Odisha in consideration and taking note of lockdown or restrictions under Disaster Management Act, decided to defer the scheduled poll.
In Assam, State BJP President Ranjit Kumar Das said that the party's parliamentary board will decide on the next chief minister of the state. Speaking to the media today, he said that the party will appoint an observer soon. The observer will visit the state and meet all the concerned in this regard and also submit a report to the parliamentary board. The BJP, with its allies, retained power in the state. Along with Chief Minister Sarbanand Sonowal, the name of NEDA convener and Senior Minister Himanta Biswa Sarma is also being discussed by the media in the state as the new Chief Minister. Tamil Nadu Governor Banwarilal Purohit has accepted the resignation of Chief Minister Edapadi Palaniswamy and his Council of Ministers. A press release from the Raj Bhavan stated that the Governor has requested them to continue until alternate arrangements are made. The release also stated that the 15th Legislative Assembly has been dissolved. The DMK will formally elect their leader M.K. Stalin as the Chief Minister tomorrow. More from our Chennai correspondent.
The new government is likely to be formed after a formal meeting of the elected members of Legislative Assembly tomorrow. DMK MLAs will elect their Chief Minister and later meet the Governor to present their credentials. In a related development, Chief Electoral Officer Satyabrata Sahu said that the winning details of Rajya Sabha members KP Munusamy and Vaidilingam, who have won the Assembly election, will be sent to the State Governor Banwarilal Purohit once they take the decision to quit their present post as MPs. Joy, AIR News, Chennai.
In Kerala, as the CPM-led LDF is all set to reign, the CPIM and the LDF will soon begin the discussions regarding the formation of the new government. Chief Minister Pinarayi Vijayan handed over his resignation letter to Governor Arif Mohammad Khan today. The Governor accepted the resignation and directed the Chief Minister to continue in office till the formation of the new government. The CPIM State Secretariat meeting, scheduled to be convened tomorrow, will hold discussion on formation of the new government. Prior to this, members of the State Politburo will also convene a meeting to discuss and decide further proceedings. While briefing the media, Chief Minister Vijayan said that no decision has been made yet regarding the swearing-in ceremony in view of the COVID surge. In Puducherry, the NR Congress leader N. Rangasamy met the Lieutenant Governor Dr. Tamilisai Soundararajan this evening and staked his claim to form the government.
In the IPL cricket, the match between Kolkata Knight Riders and Royal Challengers Bangalore, slated for today, has been rescheduled after two KKR players tested positive. Yesterday, Delhi Capitals defeated Punjab Kings by 7 wickets at the Narendra Modi Stadium in Ahmedabad. In another match, Rajasthan Royals defeated Sunrisers Hyderabad by 55 runs at the Arun Jaitley Stadium in New Delhi last evening. Now let us take a look at the weather forecast for tomorrow. The national capital Delhi is likely to have a partly cloudy sky with possibility of development of thunder lightning. The temperature will hover between 25 and 33 degrees Celsius. Mumbai will have a partly cloudy sky. The minimum temperature will be 25 and the maximum is expected to be around 34 degrees Celsius. Chennai is expected to have a partly cloudy sky with temperature ranging between 27 and 36 degrees Celsius. Kolkata will have rain or thunderstorms with strong gusty winds, and the city will observe the temperature in the range of 25 and 34 degrees Celsius. Srinagar would have a generally cloudy sky with temperature ranging from 11 to 27 degrees Celsius. Jammu will have the minimum temperature as 25 and maximum as 38. Leh will have the temperature ranging from 3 and 20 degrees Celsius. Gilgit will have temperature hovering between 12 and 34 degrees Celsius. Muzaffarabad will have the minimum temperature as 18 and the maximum will be around 38 degrees Celsius. And now before we end the bulletin, the headlines once again. Prime Minister Narendra Modi reviews growing need of human resources required to deal with COVID-19 crisis. NEET postgraduate exam postponed for 4 months to ensure availability of qualified doctors for COVID duties. Medical interns to be deployed in COVID management duties under supervision of the faculty. Medical personnel completing 100 days of COVID duties to be given priority in regular government recruitments. Government says positive approach visible in COVID-19 recoveries, says some states and duties show early signs of plateauing in daily cases. 1,500 pressure swing adsorption oxygen generation plants being developed to increase availability of oxygen in the country. Over 15 crore 72 lakh COVID-19 vaccine doses administered to eligible beneficiaries till now. Mamata Banerjee stakes claim to form government in West Bengal. Bangladesh extends lockdown till 16th of May to check the rising number of COVID-19 cases. And an IPL cricket match between Kolkata Knight Riders and Royal Challengers Bangalore rescheduled after KKR 2 players test positive for COVID-19. And with that, we end the evening news. Good night.